Hello students, this is Faizan Mirza. We are discussing autoimmune diseases and immunity this time. What are autoimmune diseases? When the body's immune cells, which include the T cells and the B cells, the T lymphocytes and the B lymphocytes, they end up identifying the self antigens as non self antigens, an autoimmune disease begins. The autoimmune response, it involves a self antigen being recognized as a non self antigen. Extensive damage to the tissue occurs because the cytokines and antibodies are attacking that particular self antigen coming from B cell and the T cell that were activated. The normal functioning of that tissue is disturbed, and with that disrupted functioning, the autoimmune disease causes extensive damage to the tissue, and the disease is progressive, it worsens with time. This is a list of the diseases that we have to cover. Except for systemic lupus erythematosus, we don't have to discuss this much in detail. But yes, myasthenia gravis is to be covered in detail, and we'll touch upon these diseases as well. So, what is myasthenia gravis? Damage to the receptors on the muscle membrane, it occurs, and this causes progressive muscle weakness. The area of the body affected is the neuromuscular junction. What's a neuromuscular junction? It is a synapse between a motor neuron and the skeletal muscles of the body. Then comes multiple sclerosis. In this disease, the central nervous system is affected. Damage occurs to the myelin sheath of the motor neurons, and it leads to progressive paralysis. Then we come to rheumatoid arthritis. In rheumatoid arthritis, damaged cells are in the joints of the limbs. This causes progressive destruction of the joints, and the area of the body affected is the joints mainly. Type 1 diabetes, damage insulin producing cells, the cells which produce insulin, which are there in the pancreas, so the blood glucose cannot be controlled. In this disease, once this has set in, the autoimmune disorder, the type 1 diabetes occurs, and these cells which are present in the islet of Langerhans of the pancreas, which is the endocrine tissue, these cells are destructed, and upon their destruction, insulin cannot be secreted as per normal. In systemic lupus erythematosus, this is SLE, there is a widespread damage to the cells of skin, kidney, and joints, and this leads to progressive deformity. All the autoimmune disorders, they can be managed, they can't be treated altogether. A rheumatologist treats these. The treatment options are giving immunosuppressant drugs to the patient and the surgical removal of thymus gland, which is the site of T cell maturation. Since T cells are the ones which are involved in the release of the cytokines, if you just surgically remove the gland, the region in the body where the T cells are going for maturation, then this protects the person from progressive destruction of these parts of the body, and thereby the autoimmune disorder can be managed. Let's come to the details of myasthenia gravis. So, to understand myasthenia gravis, we have to first of all follow how the normal this neuromuscular junction is functioning. This is the neuromuscular junction, a synapse between a motor neuron and the membrane of the muscle. What's happening in this normal physiology of a neuromuscular junction is that the impulse comes in the motor neuron and it must be transmitted chemically to the muscle, so the muscle ends up contracting. So, what's happening here? When the impulse arrives in the motor neuron, this shows to that the impulse is arriving at the axon terminal. These vesicles are already there in the these are filled with acetylcholine. Acetylcholine is a neurotransmitter, so they undergo exocytosis, and when this acetylcholine is released in the neuromuscular junction, it diffuses all across the synaptic cleft, and eventually it binds to the receptors on the muscle membrane which are present after the neuromuscular junction. So, what's happening here? The acetylcholine receptor membrane protein is already there on the muscle. When acetylcholine is absent, the sodium ion channels are closed. So, sodium ion cannot enter if acetylcholine is absent in the neuromuscular junction. The sodium ion does not enter the muscle and the muscle stays relaxed. This is how all your body muscles, they stay relaxed, because the sodium ions are not entering the muscles. Now, when acetylcholine is released from a vesicle of a motor neuron, which is because an impulse came, so the impulse came, when the impulse arrives here, it caused these vesicles to undergo exocytosis. The acetylcholine is released from the vesicles of the motor neuron. Acetylcholine will then diffuse all across this neuromuscular junction, this gap, this synaptic cleft. As the acetylcholine diffuses, eventually the acetylcholine will attach to the acetylcholine receptor on the muscle membrane. So these are the acetylcholine receptors present on the muscle membrane. These small dots are acetylcholine molecules. They go and attach to these receptors. When they attach, a channel opens. You can see that the channel has opened. With this open channel, sodium ions start to enter into the muscle. So sodium diffuses into the muscle and the muscle contracts. This is how normally the muscle is relaxed. This is how the normal muscle contracts. This is the normal physiology, or just an outline of the normal physiology of a neuromuscular junction. Now what's happening in myasthenia gravis? In myasthenia gravis, you can see that the acetylcholine is still being released when the impulse comes, but the acetylcholine receptor protein is blocked by self antibodies. There are self antibodies which are made here against a self antigen. The antigen here is the receptor of the acetylcholine. So there are antibodies here which bind to it. They block the receptor from attaching to the acetylcholine. So this acetylcholine cannot attach to the receptors here. Only few receptors are available for acetylcholine to bind. So limited sodium ions go into the muscle. So this results in a weak and a slow contraction. So this is what myasthenia gravis is. That in myasthenia gravis, there are antibodies against this receptor of acetylcholine, and it results in grave muscle weakness, which is myasthenia gravis. Neuromuscular junction is affected, which leads to progressive muscle weakness. This is all from my side for now. Thank you so much.